So in transgender rhinoplasty, we have to be very careful with a couple of things. Number one thing is that because the face width is larger, you don't want to feminize it so much that the nose looks too small for the face. So in this case, we are going to be careful about how much we reduce the tip of the nose and the dorsum of the nose so that it's balanced with the rest of her face. So we have finished the dorsal hump reduction. We have narrowed her. Swelling is starting to kick in. The tip is reduced, and we brought the tip slightly up. And now what we're going to do is splint it so that it stays in position until a week. All right, here today we are going to talk about the transgender breast augmentation. And we want to talk about some of the important things that you have to think about when you do transgender operations. Number one thing is most of these patients are on hormones, and you have to make sure that you evaluate them not only physically but also psychologically to make sure they're ready. Once you know that is in place, then treatment planning it is a little different in these patients. Number one thing is that they tend to have a stronger muscle. You do not want to put a big implant in place because the skin is not going to stretch. And the last thing is that you need to warn the patients that the incision that you put in this case, we're going in for a mammary crease. You want to use silicone breast implant because salines tend to show a lot of rippling in them. And the incision that you put in has to be planned correctly because it tends to want to lift up when you put the implants in, and then eventually settles down. So your treatment planning is very important in this case. This is a transgender breast augmentation. There are several things that we think about. Number one is that we put a smaller implant in because the skin cannot adapt and expand as much. The second thing is that we need to put it under the muscle so that we get as much coverage. Now, the other thing that I was talking about was that the incision is going to try to lift up, but that's okay because as things settle down, which usually in transgender takes about 6 months and they become soft, it eventually goes back to the fold area.